Thank you, everyone, so much for your time this evening. It is 3 minutes past 7 p.m. Eastern Time, and so I'm going to begin today's webinar. My name is Ariane Pulaski, and I am the Director of Provider Products for CE City, and CE City is the registry that powers the AASM PQRIwizard. So just to give you a brief overview of what we're going to cover during today's 1-hour session, we are going to provide an overview of the Physician Quality Reporting System. We will review the 2012 PQRS guidelines at a high level. We'll take a tour of the PQRIwizard that is still open for 2012 PQRS reporting. We'll review the 2013 PQRS guidelines, and then we'll conclude today's session with a question and answer period. If at any time during today's presentation you want to ask a question, please do so using the questions feature on the webinar menu. It may also be labeled chat, so just look for one of those two and submit them that way. We'll address all of your questions at the close of the webinar. We are also recording today's webinar, so for those of you who may want to access it at a later point in time, it will be made available to you along with a copy of today's presentation slides. So once again, thank you for your time, and we'll begin. PQRS stands for the Physician Quality Reporting System. You may have heard it called PQRI. The program used to be called the Physician Quality Reporting Initiative, but has since undergone a name change. It was developed by the Centers for Medicare and Medicaid Services in 2007, and the program to date is a voluntary pay-for-reporting program. You'll see with the beginning of the 2013 program in future years that there is some penalty structure built into the program. And it's also important to note that the PQRS program, the Meaningful Use program, and the e-prescribing programs are all separate. They have not aligned those programs yet. They may do so in future years. So if you are participating in Meaningful Use, it doesn't preclude you from doing PQRS. So please do keep that in mind. There are many different types of providers other than physicians who are eligible for the PQRS program. Essentially, physicians, practitioners, and therapists who are billing Medicare. The full list is on the screen right now, and it's also available through the AASM PQRIwizard website, and I'll point that out to you in just a moment. But as you can see, any billing provider is eligible for this program, and in turn, when penalties start to hit, they'll also be eligible for those penalties as well. So it's important to be cognizant of this information. There are 3 ways that you can report PQRS measures. One of them is through your claims. You can code your PQRS claims with the specific G codes and CPT2 codes that are in the CMS Measure Specification Manual. Your EHR product, if it is certified for PQRS submission, may be doing your PQRS reporting for you. And the third approach is registry-based reporting, which is what we're here to talk about today. When you use a registry, the reporting is done independent of your claim submission process, but the data does need to match up. So CMS will use your claims data to essentially adjudicate the data that you're reporting through the registry. But the benefit of registry-based reporting is that it gives you a little bit more flexibility in terms of the timing during which you can report your PQRS measure. So you can report encounters prospectively or retroactively if you need to. So perfect example is today, it's February 12th of 2013. We are still in 2012 reporting through the AASM PQRIwizard. You can report that all the way through March 14th of 2013. So even though the 2012 calendar year has concluded, you can still report for the 2012 PQRS program through the PQRIwizard registry. Many of you may be wondering why use a registry, why use the PQRIwizard, and the most recent statistics released from CMS indicate that registry-based reporting does carry between an 87 to a 94% success rate in terms of helping providers obtain their incentive payment. So this is some really powerful data here to absorb. When you report through claims, it's about a 53 to 61% accuracy rate. So if given the option between claims versus registry-based reporting, registry has been proven to be more accurate in helping providers get their incentive payment. The EHR reporting, according to this data, does also seem to be very reliable. I will point out that the note on the bottom of the chart says that EHR data is based on 14 providers, so you can draw your own conclusions as to whether or not that is something that you want to put some weight in. But this data is based off of the 2010 PQRS program. It did come from CMS, and the reference is on the bottom of the slide. So the AASM has made qualifying for your PQRS incentives very simple. They offer the CE Cities PQRIwizard program. It's done in a way to help make it very simple for you to report your PQRS measures quickly and easily. They even offer a pretty substantial discount for their members. Typically, the PQRIwizard is $299 per user per year, but with being an AASM member, you'll get about a $74 discount and pay only $225. So the CE City Registry has been a CMS certified registry for the physician quality reporting system since 2008. So we have many years of experience doing this type of reporting, working with providers in their practices to help them get their data reported accurately. And we, again, our 2012 submission period ends on March 14th. So there's still plenty of time. If you want to report for 2012 and take advantage of the incentive monies, you still have time to do so. You just report on your patient encounters from the 2012 calendar year. And you must do so through our registry by March 14th. So let's take a look and review the 2012 PQRS requirements. If you successfully report PQRS measures for the 2012 PQRS program, you're eligible to receive a 0.5% financial incentive payment, and that payment is based on all of your allowed Medicare physician fee schedule covered services that were furnished during 2012. In order to qualify for the 2012 PQRS program, you can report one measure group, and that's per provider, or that provider can report on 3 individual measures. If you choose to report a measure group, you would report on 30 eligible Medicare Part B fee-for-service patients. If you choose to report on individual measures, you would select 3 measures and report them for 80% of the Medicare Part B beneficiaries that are eligible for each measure. Within the PQRIwizard, we have some tools and resources available to you on that website to help you figure out which patients are eligible for the measure group or for the individual measures that are available. So now I'm going to take you through the PQRIwizard and show you what it looks like, how to access it, and basically I'll show you the screens and the progression that you would go through if you were to register and begin using this online website. The American Academy of Sleep Medicine PQRIwizard site looks just like this. When you come to the website, it is aasm.pqriwizard.com, and I'll have that URL displayed at the end of the presentation as well. Again, you do get a $74 discount, and you would pay only $225. You must go to the AASM PQRIwizard website in order to get that discount. So to give you an at-a-glance vision of how to view this, or how to kind of navigate this site, we do offer technical support. Our support staff is on hand Monday through Friday from 9 a.m. to 6 p.m. to assist you. You simply locate that support link in the upper corner of the screen and send us an email, and our staff is in-house, and they will be able to respond to your questions just as quickly as they come in. We do recommend that you add our email address to the Safe Senders list, and that will be presented to you when you submit your support request, and then that way our responses won't get caught up in any spam filters. There's also a frequently asked questions document posted on the site, so I suggest taking a look at that so that you can familiarize yourself with some of the most commonly asked questions. And finally, we have information from CMS about the PQRS program, and that includes the list of eligible professionals that we reviewed just a few slides ago. So if you're looking to access that list of who's actually eligible for the program, if you visit the AASM PQRIwizard website, it'll be listed for you there. If you wanted to begin using the PQRIwizard, you would just simply click on that Start Now button, and what it's going to do is it's going to launch you into what we call a measure selection guide. And this selection guide will help drive you to the appropriate measures, and it will give you more information about the measure group reporting or the individual measure reporting that's available in the site. So through this PQRIwizard, you can report on measure groups, which is, again, that 30-patient sample. You can also report on individual measures, which is where you would select 3 measures and report them on an 80% sample of your Medicare patients. What I'm going to show you is the measure group option. We do offer several measure groups, one of which is the sleep apnea measure group, and we will continue to offer the same measure groups in the 2013 program. For now, what I'm showing you is the 2012 measure groups that are available on the site. To learn more about any one of these measure groups or to register for one of them, you simply click on the title of the measure group, and we'll display more information for you. So to dive deeper into the sleep apnea measure group, what I'm showing you is the details for this measure group. We give you very specific information about the data collection requirements, including the eligible diagnosis codes and patient encounter codes to help you identify the patients that are eligible for the denominator. So if you were to expand on these blue plus marks that are on the screen here, it would actually expand that region. It would show you the diagnosis codes and the patient encounter codes that are eligible for this measure group. So if you're trying to figure out which patients are eligible and which ones do you report on, this is a really good place to start. Review the eligible diagnosis codes for the measure group. And again, this information is available for all of the measure groups that are on the site. So if you were looking at a different measure group, you would find similar information for that measure group. But each one of them has different denominator eligible criteria. So make sure you look at each of the respective measure groups to determine which one you want to report. We will also display all of the measures that are included in that measure group. So the sleep apnea measure group has 4 measures. The other measure groups that I showed you, like dementia and so on, may have different measures in them, and there may be a different number of measures in them, but they'll all have at least 4. So the sleep apnea measure group does have 4 measures in it. Those are all listed here. You can get a description of the measure available on this screen. And if you're ready to register for it, you would just click on that register button that's higher up on the page. So you click that register button, and then you'd be passed through a brief registration and payment process, and then you'll be taken to a screen that looks just like this. And this is where you'll begin your PQRS report. Now, you do not have to complete your PQRS report in one sitting. You will have continuous access to the system until March 14th of 2013 when we close down our submissions for the 2012 program. So if you were to register today, you could begin entering in your patients, and you could come back tomorrow and the next day or next week. You'd be able to log in as many times as you needed to, and the system will save all of the data that you've entered so that the next time you come back in, it's all there for you. The first thing that you'll do upon starting your PQRS report with PQRIwizard is we'll ask you to enter in your national provider identifier as well as your tax identification number. So your NPI number must be your individual NPI number. And, the information is provided on the site, but it's very, very important that you enter in your individual NPI number. You cannot report a group NPI number when you're reporting as an individual provider. So each provider that comes to the PQRIwizard should register with their own account, and they'll be submitting a PQRS report for the patients that they bill through their individual NPI number. You'll then also enter in your tax identification number. These 2 numbers are very important. If you make an error in either one of these numbers, CMS will not be able to basically identify you as a provider. It's the only identifying information that they receive when the data is submitted to them. So it's very important that that information be correct. We are able to validate the NPI number against the National Plan and Provider Enumeration System, but you must make sure that your tax ID number is 100% correct, and you should also verify that you've used your individual NPI number. After that, you'll just complete a brief attestation, which gives our registry permission to submit your data to CMS. It says that you're authorized to provide this information to our registry, and it's an attestation that the data you're providing to the registry is true and accurate. From there, you'll be able to select your patient sample size. Now, this is something that's unique to the 2012 PQRS program. When you come back to report for 2013, you will not see these options available to you, and I'll tell you why in just a moment. But for 2012 reporting, which again is open until March 14th, you can either select a 30-patient sample or an 80% sample, and this is if you're reporting a measure group. A 30-patient sample is beneficial if you have 30 patients that sit within a measure group and you have 30 Medicare patients. This is a good way to go. The 80% sample requires a minimum of 15 patients, and those providers that may have less than 30 patients eligible for the measure group may want to consider this option because it will enable them to still be able to report the measure group even if they don't meet that 30-patient sample option. The 80% sample is a secondary option for them, but they'll still have to report on 80% of their beneficiaries. So if you have, for example, 100 patients with sleep apnea that are on Medicare, then if you were to choose that 80% sample, you'd have to report on 80 of them. So it's probably easier in that scenario to report the 30-patient sample method. But maybe you only have 20 patients that are Medicare with sleep apnea, then you would want to select that 80% sample method because then you could report on 16 of them and still meet the requirements. The reason that this will not be available in the 2013 program is because the data collection requirements, they have actually eliminated the 80% sample for the 2013 program. So, and we'll get to the data requirements for that a little bit later on, but I did want to briefly mention that. If you are doing individual measure reporting, it's a different sampling strategy, but the site will give you instructions on how to do that. So once you have selected your sample size, you will be taken to the data collection step. This is probably where you'll spend the majority of your time within the PQRIwizard. You can enter patients by clicking on that green Add Patient button that you see on the screen, and this will bring up an online form, and that form will look just like this. So you can use the patient identifier that the system automatically assigns, or you can erase that and use something that's more meaningful to your practice. We just need a way to identify one patient from the next within our system. So, if you want to use the random alphanumeric sequence that our system assigns, you can. If you want to use something that you will recognize through your record-keeping system, that's fine as well. The system will ask you to enter in the patient visit date and the patient's age. It will ask you to confirm that the patient is a Medicare beneficiary, and it will also collect the encounter code as well as the diagnosis code that would be required of the measure group. For the sleep apnea measure group, I also wanted to show you what the questions are so that as you're going through and doing the reporting, you'll have an idea of what you're going to be expected to do. So the first question is asking, did the patient have an assessment of sleep symptoms documented, including presence or absence of snoring and daytime sleepiness? And you'll see the answer options are there as well. The second question, you can see displayed before you, and again, we provide definitions as well as the relevant answer options that CMS deems appropriate for the measure. So all of this information in the questions and answers that you see on the screen are based off of CMS's measure specifications for the measure group. So that's where this information comes from. So I want to give everyone a chance to kind of read through all the different questions, and you can come back to this later in the recorded version, but this will help you to understand what we're looking for with this measure group. And once you click the Save button, you've entered in your first patient, and you just have to do 29 more, and you'll be done for the sleep apnea measure group. Now, again, if you're reporting on individual measures, there's a different sampling requirement, and you have to report on an 80% sample for the 3 measures you reported. So do keep that in mind, that reporting a measure group has a different sampling requirement than if you were reporting individual measures. So the next thing to pay attention to within the PQRIwizard is this progress monitor. And I've expanded it for you on the screen so that you can get a good view of what I'm talking about. There is a requirement within the PQRS program that for any measure you're reporting, and this is true for individual measures as well as for measure groups, you must have a performance rate for each measure that is greater than 0%. Now, mind you, the performance rate is very different than your sampling rate. So your performance rate is actually your quality score for that measure. If you're reporting a measure group and there's 4 measures in the measure group, and you have to meet that performance rate that's greater than 0% for each measure in that measure group. The PQRIwizard will help keep track of that for you so that it's very easy to understand when you've met those requirements. So as you enter in a patient, if that patient satisfies each measure or maybe one of the 4 measures within that measure group or within the individual measures that you're reporting, you'll get a green check mark next to the measure title. So as you satisfy each measure, the check marks will display right next to these line items here that I'm mousing over. Until you've satisfied those per measure requirements, the PQRIwizard will hold you on this data collection step. And the reason we do that is because if you submit a report with a 0% performance rate for any measure, you will not be eligible for the incentive payment. So the PQRIwizard is going to hold you on this step until you've satisfied those requirements to help you qualify for your incentive payment. The other thing that it will do specifically for measure groups is it will count down the number of valid patients that you've entered, and it will be able to tell you when you've finished your reporting. So right now this report doesn't have any data in it. It's saying enter in 30 more patients and enter patients that satisfy 4 more measures. When you have satisfied all the requirements, the progress monitor will change, and it will tell you, yes, your report's ready to submit, and you can continue. If you're reporting on individual measures, it will look somewhat different, and you will actually be responsible for reporting that 80% rate per measure. Again, different than your performance rate. Your sampling rate of 80% is something that you'll have to keep track of. Once you have progressed to the next step in the process and you're ready to submit your data, we do calculate your performance rates for each of the measures that you've just reported. So we'll let you know the numerator and denominator values for each of the measures, and we'll also give you your performance rate for the measure. So this is a nice snapshot of your performance for the patient sampling that you've just done. If you're ready to submit the data to CMS, you click the Continue button one last time, and you'll be presented with the final step that lets you know your report has been submitted to the CE City Registry, and our registry will then submit the data to CMS on your behalf. We'll again redisplay the NPI number and the tax identification number that you used to submit your report. So take a look at these numbers one final time when you're on this step. Make sure that it's your individual NPI number, and make sure that it's the tax ID number that you're using for your Medicare billing. We'll redisplay the measures, the numerator and denominator values, as well as the performance rate one last time. This is a great screen to print off and file for your records and for your record of your 2012 PQRS report. And once you've reached this step, there's nothing more that you need to do. Our registry will take care of the rest as a service to you. We will submit the data to CMS on your behalf. And historically, the information about whether or not you qualify for the incentive payment is released around, I'd say, September or October in the fall. So the 2012 reports that are submitted by March, we would expect that CMS will issue information about your incentive payment eligibility by September or October of 2013. So now let's take a look at the 2013 PQRS program requirements. They are slightly different, and there's some new information to be aware of. So in 2013 reporting, providers who do not successfully report PQRS measures will incur a 1.5% negative payment adjustment in your 2015 Medicare reimbursements. So if you do not report PQRS at all in 2013, then on beginning January 1st of 2015, your Medicare reimbursements will be 1.5% less. This negative adjustment will increase to 2% for each year after that. So it's important to begin reporting PQRS measures. Some people have even told me that they are considering the 2012 PQRS year as sort of their last practice year because there's no risk of penalty in the 2012 program. So they can get familiar with reporting the measures, and they can see if they qualify without any risk of penalty. When we open up the 2013 program, you will want to make sure that you are participating so that you can avoid that 1.5% penalty. In addition to avoiding the penalty, if you participate in the 2013 PQRS program, you are still eligible for that same 0.5% financial incentive payment. Again, it's based off of your total allowed charges for Medicare physician fee schedule covered services that you have billed in 2013. So there's if you report PQRS in 2013, you will not only avoid that 1.5% penalty, but you'll also qualify for a 0.5% incentive. So really there's about 2% at stake for your 2013 PQRS participation. To qualify for the incentive payment in 2013, you can report one measure group per provider, or you can report 3 individual measures, and that will help you to qualify for the incentive payment. Again, qualifying for the incentive payment using one of these methods will also help you to avoid the penalty. So you can report on a measure group, and they've actually reduced the requirements for the 2013 program, so that instead of having to report on 30 Medicare patients, you can now, for the 2013 program, report on 20 patients, and at least 11 need to be Medicare patients. For individual measures, they have not changed the sampling requirements. You'd still be required to report on 3 measures at an 80% sample. Now, you do not have to report both a measure group and individual measures. If you do one or the other, that will suffice. If you want to report both methods, you can. So the 2013 PQRIwizard is not yet available. It will launch in the spring, and we'll send you a notification when that is available. But basically, we don't launch the 2013 program until the 2012 program has closed. But you will be able to report on any patient encounters that took place within the beginning part of 2013. So please don't feel as though you're missing out on the opportunity to report those patients. You will still be able to do so because registry reporting allows for retroactive data entry. So you'll be able to report those encounters. So at this time, I'd like to invite you to ask any questions that you may have using the question or chat feature on the webinar menu. I really do appreciate your time and your attention during today's webinar, and I hope that if I haven't answered any of your questions, that you'll please ask them now so that I can address them while I have you on the line. I have one question that's asking for the 2013 reporting for measure group reporting. If 11 patients have to be Medicare, can the other patients be from any other insurance provider? The answer is yes. So CMS essentially reduced the Medicare patient requirement as well as the total patient requirement for measure group reporting under the 2013 PQRS program. So the requirement for 2013 measure group reporting is that you report on a total of 20 patients, the majority of which have to be Medicare. So 11 or more patients need to be Medicare. But the other 9 or so patients that you report can be from any insurance provider. So the next question is asking about maintenance of certification and the PQRS incentive. So there is a program called the Maintenance of Certification PQRS program. And if you are a member of a certified, of a board of medicine, so if you're a board-certified physician and your board is participating in the MOC PQRS program, then you can be eligible for an extra incentive if you are participating in MOC more frequently than is required by your certifying board. Now, each board has different requirements on what that more frequently actually means. So you can take a look at the list of qualified boards that are participating in the MOC PQRS program. Those are posted on the CMS website. I don't know if they've announced their 2013 qualified MOC PQRS boards yet, but if they have not, they will be coming soon. So you can, visit cms.gov/PQRS, look for the Maintenance of Certification program, and then look for the list of qualified boards to see if your certifying board is participating in the program, and then you can contact them for more information on how to qualify for that extra incentive. The next question is asking, how do we know if we should submit on a measure group or on individual measure? That's a really good question, and the answer is it's sort of up to you to decide which method you want to choose. I can tell you that if you were to report a measure group for the 2012 program, you would need to select one measure group, and you would report it for 30 Medicare patients that are eligible for that measure group. If you don't have at least 30 eligible Medicare patients, then you may want to consider that 80% sample for the measure group, which is another option for 2012. So, sometimes people make a decision based on the number of patients that they'd be required to report for measure groups versus individual measures, and that decision is yours to make. With measure group reporting, again, it is a 30-patient sample. If you were to do individual measure reporting, you would select 3 measures, and you would report on 80% of your Medicare beneficiaries that are eligible for each of those 3 measures. So if you pick 3 measures that maybe represent 100 of your patients, then you'd have to report on 80 of those patients. And each measure could have a different patient-eligible population. So for measure number 1, you have 100 patients. You report on 80 of them. Measure number 2, maybe you have 10 patients. You'd have to report on 8 of those, and so on. So you can kind of get a good understanding of what the requirements would be and the number of patients you'd have to report, and then use that information to make a decision as to which option you wanted to choose, measure groups versus individual measures. So thanks. That was a good question. The next question is, can I use this PQRIwizard for the MOC credit? The answer is that the MOC credit the MOC incentive program is only offered through the boards of medicine. So you would really need to contact your participating board to see, number 1, if they're participating in the program, and number 2, how to go about qualifying for that. So this PQRIwizard site does not get you the MOC incentive, but only your board can do that. So I would suggest contacting your certified medical board to see if they're participating in the MOC incentive program. Oh, the next question is, how do I know if my EHR is participating in the physician quality reporting system? I would suggest contacting your EHR vendor and asking that question. CMS also has a list of qualified EHRs that are participating, but I would also suggest, either consulting that list, and in addition to that list, asking your EHR vendor if your installed EHR is doing PQRS reporting for you. Okay, if there are no further questions at this time, I want to thank everyone for your time. Please do visit the AASM PQRIwizard website. The URL is displayed on the screen. Again, we did record today's webinar, and we'll make the slides available to you after today's session. Those will probably be coming in the next couple of days, so we'll send you a communication when those are available. Remember that the URL to the site is on the screen right now. If you ever have questions or need help with using the PQRIwizard, please remember to contact our support team. We are here to help you, and we'd love to hear from you. Our staff is available Monday through Friday from 9 a.m. to 6 p.m. Eastern, and we'll respond to your questions in the order in which they are received. If you want to participate in 2012, and believe me, there's still plenty of time to do it, you have until March 14th of 2013 to get your report in. So, again, thank you everyone so much for attending today's webinar, and you may now disconnect.